member of We the People of Detroit Community Research Collective, and we recently partnered with Henry Ford Health System, and specifically the Global Health Initiative, to study the relationship between water shutoffs and 3 water-related illnesses. And so what we did is we correlated our data about where water shutoffs are happening across the city with Henry Ford Health System ER data about patients that were diagnosed with water-associated illnesses. So we were looking at gastrointestinal infections, we were looking at hepatitis, and we were looking at skin and soft tissue illnesses.
And what did you find out?
And we found that across the board, residents who live on a block where water has been shut off are roughly 1.5 times more likely to contract a water-related illness.
Wow. How many people did you study?
So we looked, we have a very limited data set because we've had a lot of trouble getting data from the city. We're actually currently in litigation with the city about that. We would really appreciate getting a more robust data set so that we could do a more robust study about this impact. We looked at water shutoff data from 1 year, from 2015, January 2015 until February 2016. And we had data for about 15,000 instances of shutoffs. That's an incomplete data set. So actually the number of shutoffs that happened that year were probably more like 30,000.
Yeah.
And we correlated that information against, I believe, 37,000 ER visits
Wow.
at Henry Ford Hospital for the same time period.
So water shutoffs actually make people sick.
Yes, they make people sick.
And why is this an IJC issue?
It's an IGC issue because public health affects our entire region, right? It affects our entire watershed. These are waterborne illnesses. This isn't the kind of issue that just stops at the household level. This is a public health issue. It's affecting the entire city of Detroit, and we should all be concerned about not just the contamination of our waters, but also the access to water.